you guys doing? This is Joseph here at Advanced Chiropractic Relief with Dr. Gregory Johnson. And we got Tony in here with me now. He just got his first ever chiropractic adjustment with Dr. Johnson. He's never watched the video, and he said he enjoyed it. So now I'm going to show you how I would work on Mr. Tony here. First, what I'm going to do is I'm just going to do some paraspinal trigger point techniques on his spine from his neck down to his lower back. Then I'm going to work on his legs, his IT bands. He had a meniscus surgery 5 months ago on this right knee. He's had ACL surgery on the left shoulder, but his right shoulder is giving him a little bit of trouble. So I'm going to work on pretty much his full body and show you how we do that. Show you some stretches that I'm not sure if I've shown on video before or not, but we often do it on our athletic patients who are in the gym a lot or have lower back or leg trouble. So I'm going to show you how we do that. Right now I'm starting with trigger point pressure down in his lower back, L5, S1 pocket, right along his spine. I'm just doing compressions, and I'll do those all the way up into his traps to his shoulder. You guys have been asking for a video from me for a while. We actually had some time today, so hopefully you guys enjoy this one. It'll have some different things in it that I normally don't do. So because he's had some shoulder surgery, I'm just going around. Right now I'm in his rhomboid, his trap area, up into his levator scapula. And I'm just going to work around his shoulder blade here with some different techniques just to see if I feel anything, try to loosen it up for him. Like I said, this is the one he had surgery on, but this one's bothering him. I want to feel what the good one feels like first, so once I go to the bad one, I can tell a little bit of the difference and what might need worked on. A lot of the techniques I use in here are based on what I feel. I can tell what's hurting him and what's not. Like this right here is sensitive to him. Would you say that's sensitive right there?
Yeah.
Yeah. So that's tight. So a lot of what I do, I know the area that he's hurting, but I let my hands tell me what's hurting him. Dr. Johnson uses the same thing. He calls it palpation. A good massage therapist, and also as well as the good chiropractor, we don't have to ask you if it hurts. We pretty much know where it hurts and where the pain is. And this is his good one. So where I'm at is on the back of his shoulder blade and his teres and supraspinator muscles. Work into the delt, triceps and biceps. The shoulder or the deltoid muscle, it's kind of like an onion. It wraps around and comes to a point about right in here on the side of his arm here. going to just take your arm and hang it on the table. Just change the angle a little bit. Now I'm working in his serratus anterior muscles. That's right under his armpit here. A lot of the technique that I use is trigger point and myofascial release. A little bit of stretching, because those will help his muscles relax more, which will benefit him. So I'm going to put this arm behind your back as far as you can. Put it up here. Right there. Just relax. And now I'm just seeing if his shoulder blade is sticky, has a little bit of movement. When I put his arm behind his back, it makes his shoulder blade stick out. As you can see that it's sticking up and out, I can grab my fingers right behind it, pull it, and see how sticky it is. Tony's a muscular guy, so I can feel all his muscles and the directions that they go very well. It actually helps me out. Okay, you can relax this, put it wherever you want now, sir. I'm gonna just go to this other side, and I'm gonna do the exact same thing. Start down here and go all the way up. That's a little tight right there. So what I just found out is the right side of his lower lumbar back is tighter than the left side. And that probably has to do with the way his body was tilting. His muscles need to relax now, especially now since his spine has been adjusted, because if his muscles don't relax, they can manipulate the bones or his spine, cause him to go right back out of place very quickly. That's why chiropractic and massage is very good together, because the bones will be lined up, or his spine will be lined up, and then once the muscles relax, they won't pull the bones out. His adjustments will last a lot longer.
Tony, I brought your glasses and your card and your keys up here.
Okay, thank you.
Well, try to get it right. No, you're fine, Ty.
Good morning. How's your morning going? So far, so good? Yeah. Okay, come on back here to the front, yeah.
And again, this side is sensitive too. This is his teres. Again, working on his deltoid, the onion-shaped muscle at the very top of the arm here, or the shoulder. Just a little tight in there. Is this where you're getting your pain? back in this area or near the front?
Near the front.
In this area, right?
Mhm.
Pec area.
Mhm.
So he's getting a lot of his pain in the anterior part of his delt, which the pec minor runs into that muscle as well. A lot of times with people who work out, it could be the way that they're positioning their arms when they're doing their workouts. Arms could be too close when they're doing shoulders or on their chest. They can be engaging their shoulders, which causes your shoulders to roll forward, or you're working more anterior delt all the time because your delt wants to assist your chest in certain movements. So it could be from that. So I'm gonna put this arm behind your back again up here. And as you see on this side, the same. Shoulder blade pops out, not so much as the left side, but it still comes out. We get a little bit of movement on this one as well. And I can get my fingers pretty much all the way under his shoulder blade. My fingers are all the way under there. And I just move it around there. Like that. Alright, so now I'm going to go down towards his glutes, his TFL, tensor fascia lata, and his IT band. And I'm just doing deep compressions all the way down his leg here. You can just relax your leg, I'll hold it. And all I'm going to do is I'm going to put some slight rotation into his leg. This makes his hip point up, gives me better access to the IT band. Now his IT band is a little flexed, and he can probably feel it just a little bit better. He's going to feel really good once we're all the way done. The IT band can affect you in a lot of your workouts, especially with your legs, when you do deadlifts, squats. It'll make you feel like your whole leg is tight, even your hamstrings, but Tony's hamstrings feel pretty good. It's just that IT band, it's a little tight. Come over, do the same thing on this side. This one is, you can see the major difference. It just gets tight closer to the knee here, where this one gets tighter farther up the thigh. So, Mr. Tony, I'm going to have you Turn over on your back for me.
Okay.
Please. And what I'm going to do for you now is called an active resistive stretch.
Okay.
It's probably about the best stretch you could do for your knee. You do need a partner, or you'll need some bands to wrap around your ankle, pull towards you, press away.
Okay.
So basically, what you're going to try to do is put your leg back on the table. I'm going to push against you.
Okay.
We're going to hold it for a couple seconds. I'm going to tell you to relax, and then I'm going to see if you can get some further movement in your leg.
Okay.
So this is about kind of where it starts to get a little tight right there. So now I just want you to try to put your leg back on the table as hard as you can. And relax. And see how your muscle is opening up a little bit more. So do it one more time for me. And relax. And this is a good stretch for your knee. Now, once you get used to it, you pull the toe, it tightens up the whole muscle because it'll tighten your calf up all the way down to your hamstring. And then one more time for me. And relax. You see how your leg is just opening farther up and farther up. So this is a good stretch for you to do. You can also bend your leg like this. You were having some of that hip pain right there. See how this engages this muscle there? So you can do self-massage right in there. And this is also where that sartorius is down your leg that the doc was working on. You want to do those. I call them in and outs at the gym. The abductor machines.
Right.
Those will help those hip flexors too. So we're just going to do the same to this leg. See how different it is. All right, press against me. Relax. Press against me. Relax. That's good. You can see that difference there. Alright, sir, so let me go ahead and help you up.
All right.
I'm going to get on the table and I'm going to show you the exercise
Okay.
that we like to give out. If you've ever seen a yoga stretch or Cobra, that's what it is.
Yeah.
We call ours a Superman. What you're going to do is you be down, push yourself up as far as you can, raise your chin and try to look at the wall behind you. You hold that for 10 seconds and just repeat that 10 to 15 times.
Okay.
Morning and the evening. Push yourself up, look all the way back, hold that 10 seconds, 10 to 15 times in the morning.
Okay.
After that, the exercise portion, we call it Superman. You just come up, still trying to look all the way behind you, come back down, up and back down.
Okay.
This one you don't have to hold very much.
Okay.
And then remember, when you get up, you always want to come to your side, push yourself up with your arm, even if you're on your back. Never go like this, come to your side, and come up.
Okay.
Whenever you do the sit-up, it causes the your disc to slip back.
Okay.
And that's how people end up injuring themselves. So I always want to get up on our side, push yourself up with the elbow, and then sit up sideways.
Okay.
During these exercises, it helps get the normal curve in your neck and your lower back. It's called the lordosis curve. That will help you to create good muscle memory, and it helps your body be in the correct posture to hold your adjustments longer.
Okay.
A lot of times, we slouch forward, we look down when we're texting, called text neck, and all that's going to do is cause gravity to go like this, straighten out our lower back, take the curve from our neck, and it causes long-term injuries or spinal changes. Up and back is the best thing for us. Everything you want to do is extension. He showed you back there, I showed you in here. And that's how we work on our patient. This is Tony, Dr. Gregory Johnson, Joseph, coming from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all next time.